You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, laser lipo. With us, we have an expert on the topic, Dr. Boris Volshteyn. Dr. Volshteyn, welcome to the program.
Thank you very much. Good to be back.
Now, we've had you talking about facelifts. Well-known person in Reno.
Oh, well, thank you. Thank you. We've been blessed with a lot of patient support. It's working very well. And to continue earning the confidence of our people, we're bringing new and better equipment and better procedures to our office and to our area pretty much every year.
Now, for people that don't know you, tell us a little bit about, you're the medical director, founder of Sierra
Plastic Surgery.
Okay.
Sierra Plastic Surgery is a full-service plastic surgery practice. We have on-site operating room. At this time, we're the only practice that has an actively functioning plastic surgery private
so doing it right
center.
there. Okay.
Doing it right there with all the equipment, all the safety guards and so forth. We specialize in cosmetic surgery. Most of the things that we do are minimal incision facelifts, liposuction, tummy tucks, breast augmentations.
Okay.
Do a lot of corrective procedures. A lot of people moving into the area from the other parts of the country and the world, and it just happens that we do get a lot of redos. So it keeps us busy.
So you do everything? Just
do
about.
Everything.
And
mostly we specialize in the face and the body contouring now.
And you're the quick lift person. When we see those commercials,
correct,
with
correct.
That kind of, what is that? A minimal?
It's a minimal incision mini facelift procedures that really produces significant.
I mean, that's a hot procedure.
You say when you have procedures that is producing good, reproducible, reliable results in less time, and patients are very happy, it kind of goes as a wildfire.
Okay.
And that's what happened.
Now, of course, we invited you on the show to talk about laser lipo. I called it liposuction. You said you're not always sucking fat. You're melting it. So I have questions about that. But first, let's talk about what's new, even with the face. Okay. You were telling me about some of these new techniques.
Well, we've been doing faces for a while, but always there's a thrive to do better and produce better results. Okay. And the problem we've seen is the patients who are a little bit older, who do not have the same elastic skin as the younger people, like yourself, for example.
All right, okay.
Then they need a little help. So after we do the procedure, sometimes the concern is to get the skin quality better. So one of the latest advances that we introduced is combining the smart lipo or laser lipolysis, laser and skin resurfacing procedure with the minimal incision facelift or quick lift procedure. So, because the way it works is that once we do the surgery, we really can't stop the aging process. Okay. What happens is that the skin starts to relax. So we need to do something to stop that relaxation and maybe retighten the skin again. And that's where the smart lipo laser,
so what do you do? Helps. So you're lipoing like jowly areas, neck?
Actually, we go right under the surface of the skin with a really tiny wire and go under the surface of the skin.
And it heats it? It heats it?
Correct. It heats it up instead of outside like traditional lasers. It heats it from the inside, stimulating the collagen formation. So as your body relaxes after the surgery and acquiring more natural look, as more collagen forms, you get partial reversal of that effect. So you get a secondary retightening of the skin a little bit.
Is that right?
And that's what we're observing. So I believe that.
Does that allow you to not have to pull or reposition the tissues as tight with the facelift?
No, I believe that improves the appearance later on, because after about a year, the things relax, and especially in patients who are in their 60s or 70s, they say, you know, I wish it was like it was, 6 months ago. But we can't stop the aging process. So what we've decided to do is to treat those areas of concern, like the jowls, the necks, and the bottom of the face, additionally, at the same time, with the laser. And I believe it produces good results.
Now I hear terms like liquid lift, things like this. I don't know who owns that name, but is this that type of?
It's kind of the same kind of thing. If somebody doesn't want a facelift or mini facelift and say, no, I really don't feel like it, or financially in this economy, people have to be more frugal with the money. Then we can do something that's more affordable. We can do smart lipo. And the curiosity of the procedure is that it's not suction at all. It's a smart lipo that doesn't really suck anything out.
So what is it? What is it then?
It's a technique where we put the laser through the fiber optic wire and we melt the fat in place. Let me show you.
All right, okay.
So this is the smallest liposuction cannula that we have.
Okay, so this is what you
we put in, we suck the fat out.
Okay, so that's this, all right.
That's this.
Very small, by the way.
That's very small. We still use that. It's great. Now, this is a laser fiber optic wire, and you can see what the difference is.
So you feather that in or put that in the body?
We make a little stab with a needle. the same one that we put for the IV catheters. And then through that little opening, we feed the wire. The wire is connected to the laser, and then at the very tip, the laser creates a specific frequency that is sensitive to the fatty tissue and collagen.
Is it
it's heat.
Okay.
So when you touch the fat, it actually melts or vaporizes the fat cell. And
Are you killing the fat
yes.
or dissolving the fat?
Both.
The cells.
We're melting it and we're destroying the cells. So it really cannot come back. So to speak, it's more permanent than a diet. With a diet that come back with this.
So this is fairly new technology.
It's fairly new, but it's becoming more and more popular. So the smart lipo, with the smart lipo, what we're able to do, we're able to get to the areas that were impossible with something like this.
For example?
For example, if I wanted to get rid of the jowl, the only option was really to cut it out. If I try to use something like this, or maybe a little smaller, I'm destined to create the rivets or irregularities.
Wow.
Well, with a smart lipo, when we go in, we actually really shave that area.
You say you actually do this with your hand? You're just...
Oh, it's like playing a violin.
Okay.
Just like this.
All right.
It's none of these things anymore. This is just like playing with a violin.
Why isn't everybody doing this then?
Well, it's expensive.
Okay.
So it requires significant more
But for the patient,
investment.
it's not expensive. It seems like less than traditional lipo almost.
It's the thing is that the downside of this is that I can remove significant amount of fat with this quite a bit faster than with the wire. So it does take a little bit more time.
This is for a smoother look. Is that what you're saying?
It's for two reasons. If you're athletic and you're a bodybuilder and you're in shape, and I'm jealous of you, and because I don't have time to go to the gym as much as I like to.
Okay.
So now you have this six-pack, and somewhere in the bottom there you have that area of concern that you just can't get. So if you're willing to go to the dark side, so to speak, and come to our office, what we can do, it really takes 30 minutes. And most of the time, we don't have to do any sedation.
It's like the belly button area. You're in pretty good shape. Maybe the six-pack just won't come through.
Exactly.
I can appreciate that.
We can melt that layer of the fat. We can tighten the skin from above. And now you start seeing that six-pack showing up. And if you have a very small area of fat, and I do a small cannula, what is going to happen is you're going to have rivets. So we didn't make it better, we made it different.
We've all seen the celebrity photo, or at least I have, because I read the Inquirer every once in a while.
My wife does too.
And the bumpy stomach areas. That's
very challenging.
That's interesting. I never quite got that. So it's because...
It's a mechanic of something. If you have the fat layers that's, say, 1/4 of an inch thick, and you still don't see the muscle, and you take a small cannula and do liposuction as we were taught for multiple directions to create the even look, as we like to do, you still cannot get the even look because the metallic cannula is too big.
So this is a very popular procedure.
It is a very popular procedure.
You say people are investing in themselves in economic times like this.
Well, the Anderson Cooper, as I mentioned, that men who now have to compete for the jobs, that they compete against people who are 10, 15 years younger. The bankers, the realtors, everybody in the real estate industry, mortgage banking industry, they have to compete and compete seriously. You may have years and years of experience, but if it shows that you have years and years of experience, chances are you may or may not get a job. So a lot of men are getting into the realm of they have to look good for a job. I cannot guarantee you'll get a better job or better paying job if you have cosmetic surgery.
But if you feel better about yourself, you carry yourself differently.
It's a presentation. You know, there's a good saying that we don't get the second chances for the first impressions.
Okay, with this smart lipo, let's talk about the different area of the bodies you treat. And by the way, is liposuction still the #1 procedure nationwide?
Well, after Botox and injectables, it is the most common procedure that's still performed currently. But now we have something that can either substitute it partially or complement it.
So it's that much better.
It's very good. It's very impressive. And you know, when the best thing is when the patient comes back and they're very worried. You know, they had something that they've probably seen on TV or whatever, and we're the only ones, or the first ones for sure, right now in Northern Nevada to have this machine.
So in Reno, nobody else is really doing smart lipo.
No, we're the only ones who have any laser technology of the and they're worried about looking at their stomach, and they open it up, you know, a few days later, and suddenly they start seeing their six-pack that they chances are they've never seen.
Okay. Well, everybody wants that, obviously.
Everybody does. And my nurse, we have a new nurse who's been with us for a while, a wonderful lady. She walks in, she sees six-pack, she's like, wow. And that's a good compliment to me,
so with
even
women,
if she doesn't say
what about
anything.
women? Do they want six-packs, or they just want a really tight
It depends. If you're athletic, if you're trying to get that kind of model athletic or fitness, the latest thing is not the model on the runway. It's more of a fitness model. Okay. So you want to see that look. And some areas when you're 18, you can get. But when you're older, when you're in 20s or 30s, you really can't get that as easily.
So in your 40s, by the way, okay, let's say the 40-year-old woman goes in, abs and the...
Oh, we can do a lot of things.
That area is most common?
The abs are good, the flanks are good, the under the breast little rolls that we couldn't get with these canals.
Like in the bra strap in the back?
In the bra straps, correct. Then the little folds right above the breast.
You mean in where the arm?
So there are a lot of women who avoid the clothing that shows off this area because the skin doesn't quite look good. And that's where this really can be very handy.